A veteran walks into a VA hospital. He's fought for his country, served with honor, and now he's here, expecting the care and dignity he's earned. Maybe it's a routine treatment. Maybe he's recovering from an illness, but one thing is certain. He should at least be safe. Yet, in the Northampton Fay Medical Center, some veterans never made it out. Their deaths weren't due to war, injury, or illness. They were unexpected, sudden, unexplained, and worst of all, they weren't accidents. Kristen Gilbert was a nurse at the Northampton Veterans Affairs Medical Center in Massachusetts, a place dedicated to caring for those who had already sacrificed so much. She was smart, charismatic, and seemingly competent. But beneath the surface, there was something dark lurking. It started as whispers among the staff. A joke here, a nervous laugh there. They called it the death shift, because every time Gilbert was on duty, patients kept dying. And the worst part. The ones dying weren't the most fragile or the most at risk. They were veterans who were stable, recovering, and then, suddenly, gone. One by one, these men, heroes in their own right, began to suffer fatal cardiac arrests. Henry Hudon, just 35 years old, this Air Force veteran was young, relatively healthy, and expected to recover. But under Gilbert's care, his heart suddenly stopped. No one could explain why. Stanley Jagodowski, a 66-year-old World War II veteran. Stanley had survived war but didn't survive his hospital stay. He went into cardiac arrest without any warning signs. His family was stunned. This wasn't supposed to happen. Kenneth Cutting, a 41-year-old Army veteran. He had been through so much, but nothing prepared him, or his loved ones, for a fatal heart attack that no one could explain. Edward Squira, a 69-year-old veteran who had been receiving treatment at the VA hospital. His death, like the others, was sudden and seemed unnatural. These men, who had once worn the uniform and served their country, never got the reliable care they deserved. They should have been able to trust their nurse. Instead, she betrayed them. Kristen Gilbert had found a way to kill without raising suspicion, at least at first. She used epinephrine, a drug that, in controlled doses, can save lives. But in large amounts it triggers a fatal heart arrhythmia, causing a sudden, violent cardiac arrest. She was careful. No autopsies were ordered because there were no obvious signs of foul play. But the pattern was undeniable. Patients were coding at an alarming rate, and Gilbert was always there when it happened. And the most chilling part? She didn't do it out of mercy or necessity. She did it for attention. When her patients coded, she got to be the hero. She would call the code, jump into action, and thrive in the chaos. She even flirted with emergency responders while patients were dying under her care. At first, the death seemed coincidental. But soon, nurses and doctors began noticing the unnatural number of sudden cardiac arrests occurring during Gilbert's shifts. Some joked about the death shift, but underneath the humor was a deep unease. Too many deaths, too many unexplained tragedies. The hospital conducted an internal investigation and discovered something shocking. Epinephrine was disappearing. Not only that, but Gilbert had been present for an abnormal number of fatal cardiac arrests, far beyond what any other nurse had experienced. Then came an anonymous tip to hospital administrators, which led to the FBI getting involved. In 1996, Gilbert was questioned. Instead of staying to defend herself, she quit her job and walked away, a move that only made her look more suspicious. But the damage had already been done. Investigators exhumed bodies and found lethal doses of epinephrine in their systems, clear proof that these weren't natural deaths. The evidence was overwhelming, and in 1998, Gilbert was arrested and charged with multiple counts of murder and attempted murder. And just when it seemed like she couldn't make things worse for herself, she did. In a desperate attempt to avoid suspicion, Gilbert called in a bomb threat to the hospital, thinking it would throw investigators off. Instead, it only strengthened the case against her. Her trial began in 2000. Witnesses took the stand, nurses, doctors, even family members of the deceased. The prosecution painted a horrifying picture, a nurse who played God, taking lives at will, all for personal gratification. In 2001, Kristen Gilbert was convicted of 3 first-degree murders and 1 second-degree murder. The jury spared her the death penalty, and she was sentenced to life in prison without the possibility of parole. Veterans fight for their country, trusting that when they return home, they will be cared for. Kristen Gilbert shattered that trust. She didn't just take lives. She preyed on the vulnerable, on those who had already sacrificed so much. And she did it for her own sick need for attention.